Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. We're joined tonight by Assistant City Manager Dr. Colleen Bridger, and this is our COVID-19 update for the San Antonio community. Today's weekly vaccination report shows that 855,326 individuals have received at least one dose of the COVID-19 vaccine here in Bexar County, and 586 people have been fully vaccinated. This means that we now have 55% of our population who has at least one dose and 36% who are fully vaccinated. We continue to exceed both state and national averages, and we are calling on you to let folks that you know who haven't been vaccinated get their appointment as soon as they can. As a reminder, people ages 16 and up can now go to the Alamo Dome on a walk-in basis from 12 p.m. to 5 p.m. or until capacity is reached to receive the COVID-19 vaccine without an appointment. And remember that you can also subscribe to vaccine alerts to be notified when there are appointments available by texting vaccine or vacuna to 55000. Again, you do not need an appointment now to get a vaccine. It's simpler than ever, so please go get your vaccine as soon as you can. Tonight, we're reporting 233 new cases of COVID-19, which brings our total number to 216,339. Our 7-day rolling average is now 246. I'm pleased to report that our positivity rate is at an all-time low and a state leading number now, 1.9%, and indicators remain steady. Last week, we tested 57,000 people in Bexar County, and we continue to see a low positivity rate locally. And again, we've been doing better in that department than I think all major metros in the state of Texas. So let's continue to do our work on that and work together to contain the spread of this virus. Fortunately, today we have no new deaths to report today. Please, again, note that our family and friends and neighbors have been reeling from this disease and have lost many of our loved ones, so please continue to keep them in your prayers this evening. There are 262 COVID-19 patients in our local hospitals tonight. Over the last 24 hours, there are 25 new admissions. 80 patients are in the ICU, and 50 are on ventilators. Let me turn it now to Judge Wolf.
Thanks, Mayor. You know, it's kind of like we've been in a 7-furlong race coming around the last bend, coming into the home stretch and looking good, but you can still hear the hoofbeats of the dark god of COVID behind you, and you don't want to let him give a chance to catch you. So if we don't want him to catch us, what do we need to do? We need to get vaccinated. Last week, we did 25,697 at the University Hospital site, but of those, 14,000 were second doses. So we're seeing our numbers continue to go down. I think we were doing 35,000 or so a week, working on some different strategies to try to reach people, smaller events. I know that Commissioner Justin Rodriguez is working on an event at St. Mary's University. We made some grants to the chambers, and I know the Greater Chamber is going to start on a program trying to get more vaccinations, maybe at the workplace, another event at St. Margaret Mary's Church. So we're all trying to reach out to smaller venues and try to make sure everybody has that opportunity to get the vaccine. You know, we have been very successful compared to other areas, but still, there's a lot of people out there that haven't. We know that some, was absolutely refused to do it, and of course that's their choice. But if you're thinking about it and you want to do it, there's a lot of opportunities for you to get your shots in an easy manner today.
Great, thank you, Judge, and we are looking forward to seeing more of our neighbors vaccinated so we can start to put this pandemic firmly behind us. As you know, we've been asking our doctors on the air frequently asked questions that come into our mental health department. So I'm going to give now Dr. Bridger a question that we've gotten quite often, and that is, Dr. Bridger, is it safe for a woman to get a COVID-19 vaccine if she would like to have a baby one day?
Yes, 100% yes, please do. If you are planning on becoming pregnant, more and more research is showing just how dangerous COVID infection can be for a pregnant woman and her unborn baby. And the research is also very clear that there are no risks associated pregnancy-wise with getting vaccinated. So I know that there was a a nasty rumor out there to that effect. So I'm really glad we got this question today. Please, if you are thinking of getting pregnant, do get vaccinated. That is in the best interest of you and your baby's health.
Great. Thank you, Doc. And now for an update on our blood supply, another emergency that we've been dealing with in our Bexar County area. The South Texas Blood and Tissue Center reports that the demand for blood continues to exceed donations, and now our inventory is down to just a 1.5 day supply. Type O blood, which is used in emergencies, trauma care, etc., is even more critical at just a day's supply. So we do need your help. Everyone listening, if you're able to donate blood, we need you to make an appointment at one of the 6 South Texas Blood and Tissue Center donor rooms in this area, as well as any of the community blood drives that are beginning to happen again. As mentioned last week, an additional 200 blood donors a day is still needed. So if you can, make that appointment at southtexasblood.org. You can also schedule an appointment to give blood at University Hospital by calling 210-358-2812. As always, you can get the latest on COVID-19 by texting COSA.gov to 55000 or by going to the website covid19.sanantonio.gov. On that website, you will also find assistance programs. If you're struggling paying rent or mortgage through this pandemic, there is assistance available for you. You can go to the website or call 311 for the rent or mortgage assistance. And if you're out of work, without a job and a loss of income, there is also a training program that is training people for jobs that are available in our community today while you receive a stipend to make ends meet. More information, again, by calling 311 or by enrolling at 210-224-HELP. And a final note, polls are open from 8 a.m. to 8 p.m. today and tomorrow for early voting. So if you are a City of San Antonio resident and have not cast your ballot, please consider going to early voting 8 a.m. to 8 p.m. And again, please continue to do your part. We're doing very well with COVID-19. Wear your mask, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. With that, the judge, myself, and Dr. Bridger are available for questions.
Dr. Bridger, with both Moderna and Pfizer saying that people will need a booster vaccine between 6 to 12 months after, do you have a plan in mind or already set for healthcare workers and anybody who got the vaccine in December whose durability could be over this summer?
We have received those recommendations from the drug companies, but we have not received those recommendations from the CDC. And so that would be the next official step to make that an actual recommendation. If that does happen, the good news is there is enough supply out there that people can get it through their normal sources. So they can go to their doctor's office, they can go to their pharmacy, and we'll likely continue to have these pop-up events. So this is another part of COVID, which we're learning every day, how to protect ourselves best from COVID. If the recommendation comes out that you do need a booster and the time frame is better defined, we will communicate that far and wide, and we will make sure that people have that opportunity.
We're already seeing that some people are not making their second dose. Do you think that possibly telling them they need a booster vaccine, a third shot, will hinder the process we're already making?
I don't know. What I can tell you is that the second dose appointments are doing remarkably well compared to the first dose appointments when it comes to no-show. So we have about a 10% no-show rate for second doses. And some days it pushes 40% for first doses. So for the most part, once people get that first shot, they're good about coming in for the second shot. I don't know how good people will be coming in for their third shot. I just don't know.
And I would like to add, though, that one of the things that we're trying to impress on everyone out there is that they haven't gotten a vaccine yet. It's very easy. You really don't even need an appointment anymore. Just show up afternoon at the Alamo Dome. There are doses available, I think, on Saturday. Dr. Bridger, we had over 500 people show up. You don't need an appointment. So it is easier than ever. You don't have to wait on hold all day long. You don't have to continue logging into the website. You can just show up, get your vaccine. The most important thing we can do as a community in order to enjoy the things that we were before this pandemic is get as many people as possible vaccinated as soon as possible.
And Dr. Bridger, I know you said you're waiting on CDC recommendations, but will this only be a third dose, or will it have to be a repeated series?
What I am reading is that it would be a third shot, so not that you have to start all over again.
Dr. Bridger, what should people know before getting the J&J vaccine, and what are local officials doing to calm any concerns that have arisen since the pause of that vaccine?
So the first thing you should know is that the vast majority of providers who are offering the Johnson & Johnson vaccine are also offering an alternative vaccine. So if you do not want the Johnson & Johnson vaccine, you do not have to have it. The second thing is what we found during this pause is that it's incredibly safe. There are a very few number of people who had a potentially related side effect compared to the over 7 million doses of the Johnson & Johnson vaccine that have been administered. So, one, if you don't want it, you don't have to have it. And two, it's incredibly safe. My son has had it, so I'm speaking from a mom who has no qualms about the fact that my son got the J&J vaccine.
Have there been any additional breakthrough cases in Bexar County since the 2 that were reported earlier this month? And what do people need to know about the risk of contracting COVID after getting vaccinated?
We've had 7 people who have had both doses of their COVID vaccinations who've gotten a COVID infection. So again, listening to the numbers that the mayor read off, 35% of our entire population over the age of 16, and only 7 have had breakthrough cases. It's incredibly effective vaccination.
COVID hospitalizations have risen 40% since the start of April. Do we know what factors are driving the rising number of patients?
We were talking about that just earlier with the mayor and Colleen in our group, and we don't know the answer to that yet, but I think we're up 80 some odd people in the hospital from our low number of 176, while our infection rate is going down. We don't really know whether it's a variant or what it is, or why there's still people going to the hospital, but it's a concern. But the numbers again are very, very low. We got 200 and some odd in the hospital, and I think we were 1,800 or so during the time up. So I don't think it's a cause for any alarm yet, but it does make you wonder why.
Are monoclonal antibody infusion treatments still underway at Freeman Coliseum?
No, they're not. What they did, we were doing 90 a day out there during the bad part of the epidemic, and then it went down to only 10. So what they've done now, they've created a mobile unit, and they go, again, a doctor has to prescribe it. They actually go to the patient's home and do it. Now, they're not the only ones doing that now. The other hospitals are picking it up and doing the same thing. So if a doctor prescribes it, they'll come to your house with a mobile unit, and you'll get the infusion there.
Judge, can you discuss how it's going at Freeman Coliseum regarding the unaccompanied minor migrants, and how much longer will the contract last? Do you expect it to be renewed?
Well, the contract is for, I think, till the end of May. We've been there almost a month now. And so what was slow in going as they staffed up was getting caseworkers to be able to get the children assigned to a guardian. They've started to pick it up now. 129 have been assigned to guardians. 24 have aged out of it, and 14 have been transferred to a licensed facility. So our population numbers are going down. And the other good thing that's happening right now with respect to COVID, we only have 46 that are in the COVID. We have a separate unit for them, able to handle over 300 and down to 46. I think we were around 80 or 90 at one point. So that's a good sign, and we test every 3 days. Out at Lackland, they opened up a Lackland. They have 369 young kids at Lackland, all boys, and 44 of them have the COVID, and they've been isolated. So our numbers are starting to come down. I don't know what will happen at the end of May, where they will be. Hopefully they will have every kid placed somewhere, but we'll have to wait and see.
Is there any additional information regarding Governor Abbott's allegations of child abuse inside Freeman Coliseum?
Completely false. Now, if anything's happened since then, when he said it, there was nothing. Now, other things could happen. I don't know that they have. I have not heard anything. It could happen in the future. With what do we got now? 1,802 boys still out there. Something could go wrong. But the previous allegations that he made were untrue.
That's all we have tonight. Thank you.
Thank you.